Maryland is now one of 13 states in the U.S. to see a case of measles this year. But while there are at least 3 outbreaks going on, health officials say this case is not associated with them. WMER2 News' Elizabeth Worthington joins us now with why public health experts say Maryland is generally in pretty good shape. Elizabeth?
Yeah, Kelly, so measles is extremely contagious. 90% of susceptible people who spend time in the same room as someone who has measles, even if it's only for 2 hours, 2 hours later, will get it. But if most of the people in that room are vaccinated, the disease will stay contained. So the hope is that Maryland's high vaccination rate will keep the spread of measles at bay. Although measles was considered eliminated from the U.S. 25 years ago, in recent years, epidemiologists could see the writing on the wall. Vaccination rates were starting to dip in the U.S., and cases were starting to rise globally. An outbreak was likely.
It's the most contagious germ that we know of.
So you only need a small proportion of susceptible individuals or unvaccinated individuals in order for the virus to spread and cause outbreaks.
And that's what we're seeing in Texas and New Mexico, where the majority of the 222 cases reported by the CDC have been located. Most of the patients are unvaccinated, school-aged children. There's now 1 case confirmed in Maryland, a Howard County resident who recently traveled abroad. The Maryland Department of Health says this case is not associated with the outbreaks elsewhere in the U.S.
There has been an uptick of measles globally since the pandemic.
WMAR2 News spoke to Dr. James Campbell, a pediatric infectious disease specialist at the University of Maryland Children's Hospital, and Dr. William Moss, an epidemiology professor at Johns Hopkins Bloomberg School of Public Health. They say the good news for Marylanders is that our state has a vaccination rate that's higher than the national average.
Close to 97%, whereas the national average is somewhat below 93%.
So in the past, when there's been a singular case of measles in the state, like in 2023 and 2024, it stayed at just a singular case. But the concern lies in communities where the vaccine coverage might be a lot lower than the rest of the state.
Those few percent that are not, sometimes they cluster together.
The state health department put out a warning over the weekend that anyone who was at the Washington Dulles International Airport Terminal A on transportation to the main terminal or in the baggage claim area on March 5th between 4 and 9 p.m. may have been exposed. Additionally, if you visited the Howard County Medical Center Pediatric Emergency Department on March 7th from 3:30 to 7:30 p.m., you should monitor yourself for symptoms.
And for those who might have, chosen in the past not to be vaccinated because they thought that measles, was not around, and so they didn't think that their child needed the first or the second shot. It's around. It's going to come back again, probably.
If you believe you were exposed to measles and you start to experience symptoms, the Maryland Department of Health asks you to call your doctor before just showing up to a waiting room or an ER so they can take measures to prevent the spread to other patients.
So when will we know whether this case has spread to other Marylanders?
Yeah, not for a while, because the incubation period for measles is really long compared to the flu or the cold. It's about 2 weeks before people actually start feeling the symptoms, and this case was just confirmed yesterday. So about 10 to 14 days from now, maybe we'll know if the case was contained or if it spread.
So just stay tuned.
Yep.
All right. Thanks a lot, Elizabeth, for that report.